Greetings from Narayana Health. Myself, Dr. Hiremath Sagar. I'm working as consultant pediatrician at Majumdar Shah Medical Center, Health City, Bangalore. Today, on the occasion of World Health Day, I would be talking to you on the topic of growth and development in children. So, growth and development are used interchangeably, especially with respect to children, but they are actually different. So, what do you mean by growth? Growth is nothing but the improvement in the physical characteristics like height, weight, head circumference, mid-arm circumference, chest circumference, etc. Whereas development refers to attainment of the milestones, like the child starts walking, running, talking words and all. So this is called as development. So the both are used interchangeably, but they are actually different. Now let's talk about growth. So how a parent can say that his child is growing appropriately or adequately? So one is, assessment of growth is based on height and weight of the child. Other parameters like head circumference, chest circumference, mid-arm circumference are used in the younger age group. So we need to see whether the child's height and weight is appropriate as compared to his age. Okay, so usually your pediatrician will know what should be the ideal height of a 10-year-old, what should be the ideal weight of a 10-year-old, or differently. So based on that, we can say whether a child's height and weight is appropriate for his age. The best way to tell whether the child's growth is correct will be based on growth charts. So you can find it on Google and WHO website or IAP, Indian Academy of Pediatric website. There are many growth charts are there. Your pediatrician can mark his weight of your child's height and weight on the growth chart and decide whether it is appropriate for age or not. Another advantage of growth charts is we can actually plot the graph so that we will know how is your child growing, whether it is appropriate for the age or it is more or less. We will be able to identify it very quickly on a visible basis. So many times parents come to me saying that, sir, he was growing quite well till last year, but this year he has neither put on weight nor he has grown in height. So I tell most of these parents, see, the maximum growth happens during either in the first 2 years of life and then during the adolescent period. So this is the age when the child gains height and weight more in these two periods. So you don't need to worry, say if your child is like between 6 to 10 year or 2 to 10 year age group, you don't have to worry that he's not putting weight or he's not gaining height significantly, because the maximum height a child can gain during this period is 6 centimeter per year or a weight of around 2 kgs per year as such. So you don't have to worry as such. So growth charts are the best to assess a child's development and decide whether the growth is appropriate or not for the child's age. Also, many parents come to me saying that, my son is older, but his height and weight seems to be, short, and his sister is growing much taller. So many times as a parent, as a doctor, I tell them that, the development and growth varies between girls and boys. So girls have a different growth range as compared to the boys. For example, most of the time they attain puberty a little earlier at around 11-12 years of age, whereas the boys start their puberty at around 13-14 years of age. Okay, so whenever they attain this puberty, there will be an acceleration in their height and weight, and because of this difference in the pubertal age, girl seems to catch up in around 10 to 12 years of age, and however the boys continue their development till 18 years of age and attain a higher weight and height as compared to girls. So many parents also come to me saying that their child is shortest in the class or shortest among all the group of friends he has or among the relatives' children. So we need to remember that a height does not depend only on the child, it also depends upon the parent's height and also the genetic potential of the child. So in case any parents come to me like that, usually I assess the mid-parental height. That is, based on the parent's height, I can guess what can be the adult height that can be achieved by the child, number one. And number two, based on the graphs, I can also mark what should be the height of that child at this particular age when I am seeing this child. So in case if I find that the child's height is lower than the expected, then I will have to evaluate why the child's height is not normal and find the cause and then treat the child. And many parents ask me, sir, we are already short. Is there any medicine or there any injection which will help my child to become taller? So unfortunately, the answer is no. No medicines or no injection can help a child to become taller. It is not good for health using these supplements and other things. That is number one. Second, the only way we can exceed our genetic potential to height would be a balanced diet, good physical activity, and an enriching home experience. So all these home environment. So all these three factors will go a long way in achieving more than what our genetic factors allow us to do. Okay. And lastly, regarding growth, when should a parent be worried about the growth of their child? Now, very simple. Number one, you feel your child is very short as compared to yourself. And number two is your child is significantly underweight or overweight as compared to the age and sex of the child. If these things are there, please take your child to a pediatrician, let him assess, see whether the growth and is normal or abnormal, and then do the needful for your child. So now let's go to the development. So what do you mean by development? Development is the process of attaining milestones so that the child can function optimally. So the development is divided into 5 spheres. The first one is gross motor, like walking, running, climbing stairs, etc. The second one is fine motor, like grasping the things and scribbling, etc. The third part is the personal social development, that is the child recognizing mother, having social smile and waving bye-bye, playing with the friends, helping with dressing and undressing, etc. And the fourth one is the communication, that is language. It can be both verbal and non-verbal, and the child speaks few words or words with meaning, and also sentences over a period of time. And lastly is your cognitive skills, like following simple commands, doing things, imagination, etc. So these are parts of the development. So what should a parent observe about their child's development? As a pediatrician, I would like the parents of any child to remember some of the milestones and when they were achieved. Like in gross motor, I would like the parent to know when the child started controlling his head or neck control, when the child started sitting without support, when the child started standing without support and walking without support, climbing stairs, etc. And in the fine motor, I would expect a parent to know when he started holding the things firmly, when he started pincer grasp. Pincer grasp is nothing but catching the small objects like a pearl or a bead or a seed with the 2 fingers. And then when he started helping in buttoning and unbuttoning the shirt, when he started building towers and etc. So these are some of the milestones. In the language, I would like to know when he started cooing, when he started bisyllables, when he started speaking 2 words with meaning, when he started speaking with in a sentence or a small sentence like 3-word sentence. That would again help me in assessing the development of the child as such. Okay, and also parents should know what is abnormal. That is, he is not able to stand without support by first birthday, it is abnormal. He is not able to walk without support by 15 to 16 months, it is abnormal. He is not speaking any word by 2 years of age, is abnormal. So you also should know what is abnormal. If you think your child is coming in this category, you need to take the child to the pediatrician for a proper assessment and intervention as such. Now coming to the next part, like, what can go wrong? As you know, for the development, brain is the most important thing. So the brain develops from the point of conception to 2 years of age. So this is the maximum amount of maximum time when the brain develops significantly. So anything which goes wrong during this period can affect your child's development. So during pregnancy, if the mother has got any illness like blood pressure or diabetes or any other illness, or she has got some stress, or she did not take proper nutrition, it can affect the child's brain development and affect the development of the child. And delivery process is a very stressful thing, not only for the mother but also to the baby. Many things can go wrong during this process, which can affect the brain and in turn affect the development of the child. So after the delivery, first few days are very important. The child should feed well, the child should not get any infection, the child should not be sick. So many of these things will also go a long way in affecting the brain growth and then development of the child. So in case any problem happens in any of these things, then your child's brain development can get affected. Okay, so nothing has happened, your child has been delivered very well, he cried immediately after birth, his weight was good, he did not have any illness, but still we need to take care of our child. So we can enhance his growth potential by focusing on a framework called nurturing care framework. Okay, it is for all parents. It consists of 5 components. The first component is good health, so you should maintain your child's health in a very good manner. Second is proper nutrition, give adequate nutrition to the child. First 6 months give exclusive breastfeeding and then complementary feeding as advised by your pediatrician. The third thing is responsiveness, that is, as a parent we should respond to the child's need. We should be attentive, we should be attentive to child's need, what he wants, and we should respond to it properly. And the fourth thing is we need to give opportunity for the child to knowledge, and so we may have to interact with the child frequently. We need to play with the child, interactive with the child. We need to give him toys which will help us stimulate his brain growth and development as such. And lastly, we need to provide him a safe environment, that is, protect him from any hazards, protect him in any stressful situations as such. So all these 5 components will go a long way in improving your child's development. And also parents can do something called as early stimulation, that is, we can do some things like allow the child to play with different colors, give him stimulation through light, music, sound, etc., which will help in development of the child. So what should a parent do when he is not happy with the child's development? He feels his development delay is there. So best thing would be to take the child to a pediatrician who can do a proper assessment and decide whether the child's development is normal or abnormal. If abnormal, he will then investigate for the cause of the developmental delay and provide intervention either in the form of medications or physiotherapy. Rarely, the pediatrician may also refer the child to a specialized center wherein there are developmental pediatricians, there are physiotherapists, occupational therapists, speech therapists, etc. A team is there who can take care of the child's development as such. So these are some of the points which I would like to tell to the parents regarding the growth and development of their child. Thank you.